policies, which he believes were designed to benefit the few rather than the majority. And finally, in her second public appearance after more than a year in hiding, Venezuelan opposition leader Maria Corina Machado has promised that, one way or another, the presidency of Nicolas Maduro will end. Speaking to reporters in Oslo in Norway yesterday, Machado added that she was still hopeful that a change in leadership in Venezuela would be peaceful. Her latest statement comes as the administration of US President Donald Trump maintains its buildup of military forces in the Caribbean. The Trump administration has repeatedly struck alleged drug smuggling boats in the region and what experts say amounts to extrajudicial killings. The president has also in recent days repeatedly threatened to begin operations on Venezuelan territories in what he has characterized as actions to stem illegal drug flows from the country. Maduro has accused the Trump administration of seeking to topple his government. Some critics have accused the U.S. of aiming to open up Venezuela's vast oil reserves to the U.S. and Western companies. Taking a look at the temperatures, Durban is at 19 to 25, Richards Bay 21 to 29, Ulundi 17 to 31, Ladysmith at 15 to 26, and Margate is at 18 to 24. That's it for now for Radio Al-Ansar News. I'm Tabi Umar.
Radio Al-Ansar, keeping you in the loop.
Color your world with Color Trade Paint.
I sent it to you.
Interior and exterior coatings. We got you covered with our wide range of roof colors and a stockers of industrial floor coatings. A Color Trade innovation.
Which number?
I
sent it on the
Oh,
okay, sweet.
Yeah. The story driveway with high durability jet black tar coat, 690 rands per 20 liters. Get to a Color Trade Paint store near you or visit our e-store. Call 086-126-8888 for free delivery. Make the right paint choice. Always ensure color before trade. Buy Color Trade Paints.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD. And now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio-visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickhill Road, Oldport. Simplex Radio, the name you can trust.
This is Nightline. Nightline is the only program that allows you to listen to the opportunity to voice your opinion on any matter or any topic that concerns you. Also on Nightline, we interview the famous, the not so famous, and infamous. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Brother Muhammad Vuyelwa, and with me in the studio is Dr. Anwar Jiwa. Join us every Saturday night from 8:30 p.m. to 10:30 p.m. on Nightline, the program designed especially for you, the listener.
ادعو إلى سبيل ربك بالحكمة والموعظة الحسنة وجادلهم بالتي هي أحسن. Invite all to the way of your Lord with wisdom and beautiful preaching, and reason with them in a way that is best and most gracious. Join Shabir Pasha every Saturday at 7 p.m. on the show Dawah Dynamics, and every Sunday on the Dawah Chronicles at 9 p.m. remembering the companions of Prophet Muhammad, peace be upon him. Join the discussion, analyze the lives, sacrifices, and contributions of the Prophet's companions, and learn from their experience.
اللهم انصر إخواننا المستضعفين على أرض فلسطين. اللهم انصر إخواننا المستضعفين على أرض فلسطين. اللهم حرر المسجد الأقصى من اليهود الغاصبين. اللهم انصر إخواننا المرابطين على أرض فلسطين. اللهم شد أسرهم وسدد رميهم برحمتك يا أرحم الراحمين. اللهم الطف بإخواننا في كل مكان يذكر فيه اسمك يا أرحم الراحمين. استنصروك يا الله فانصرهم. اللهم ارحم الضعفاء والفقراء والمساكين والأيتام والنازحين والمشردين والأسرى يا أرحم الراحمين. اللهم أنج المستضعفين من المسلمين في فلسطين. اللهم كن لهم عونا ونصيرا. اللهم كن لإخواننا المرابطين في المسجد الأقصى. اللهم كن لهم ولا تكن عليهم. اللهم فرج همهم، نفذ كربهم، داو جرحاهم، عاف مبتلاهم، اشف مرضاهم، ارحم موتاهم، تقبل شهداءهم.
Radio Al Ansar, 24/7, 365.
The views and opinions expressed by the guests and presenters of Radio Al Ansar are not necessarily the views and opinions of Radio Al Ansar and the Al Ansar Foundation.
Doctors and guests on a Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
You're listening to a live broadcast from Radio Al Ansar, Pietermaritzburg, 105.6 FM.
See the light of the moon. Did you look at the sun giving you warmth? Did you look at the sky? Are you falling in love? It is from the Creator. You can't get enough. He is everywhere, and He knows we stay. Yes, He knows. Yes, He knows. He knows. You've got the world in your hands. He's the one who we're thanking for life. He is a Rahman. He is a Rahman. See the birds how they fly, feel the tears when you cry. He's the one who gives everything. He'll never leave you behind. 'Cause He's the one that always makes things better. And He's the one that always lives forever. He's everywhere. He knows we stay. Yes, He knows. Yes, He knows. You've got the world in your hands. You gotta thank Him for life. He is a Rahman.
Assalamu alaikum wa rahmatullahi wa barakatuh to our listeners. You are connected with Shubnum Ismail and welcome to the Pietermaritzburg Pulse Show on Radio Al Ansar 90.4 and 105.6 FM. As we gather in the spirit of unity and enlightenment, I'm honored to be your host, guiding insightful conversations and exploring the richness of our shared values. Join me on this journey of discovery and growth as we delve into topics that matter most to our community. Let's embark on this extraordinary adventure together, and may our time be blessed with wisdom, laughter, and inspiration. May this medical show be a beacon of education and a source of guidance for us all. Today's show, we are stepping into a crucial part of our body that often gets neglected until problems arise: our feet. We are talking about common foot disorders and treatments, and we're here to shed light on the importance of foot health. Let's take a step in the right direction and explore the best ways to keep our feet happy and healthy. Vuyelwa Mpala is a podiatrist, and I'm so amazed to have her on today's Pulse Show. Welcome to the show.
Thank you for having me.
Listeners, with over 20 years of experience as a podiatrist, Vuyelwa is a foot specialist extraordinaire. She's worked in the UK's NHS and now brings her expertise to South Africa. She's all about keeping our feet happy and healthy, from diabetic foot care to sports injuries, and even helping tiny tots and seniors with their tootsie troubles. Vuyelwa's a rock star in the podiatry world, registered with the Health Professionals Council, and even lends her expertise as deputy chairperson of Diabetes South Africa, DSA, in Pietermaritzburg. We're honored to have her share her knowledge with us. So let's dive in and get our feet talked about. Vuyelwa, can you enlighten our listeners what you do in your career and what is a podiatrist?
Okay. A podiatrist is a medical health professional who deals with the lower limb and the feet. We assess, diagnose, and treat conditions of the feet. Obviously, one part of the body is connected to the rest, so we need to have a good understanding of different medical conditions that affect the body and will also affect the feet, because a lot of people tend to forget the feet are attached to the body. So yes, we do. We have to have a good understanding of different medical conditions that affect the feet, and so we assess, diagnose, and treat conditions of the feet.
Excellent. What are some common foot problems do you see coming into your practice?
The most common problem we have is corns and calluses. So calluses are hard skin. It's found on different pressure points of the feet, high pressure points in particular. Some of it can be avoided, some of it can't be avoided. So we manage it and educate and treat the conditions.
Let's talk about hygiene and toenails. So, can you give our listeners some tips about maintenance and how can they take care of those toenails?
Okay. In most cases, you find that, especially in humid areas, of which we live in a very humid areas, the most common problem is fungal nail infections. With fungal nail infections, you've got fungal spores everywhere. Fungal spores last outside its environment to breed for several days, months. And when you create the right environment for it to breed, it breeds, it multiplies. So the right environment for that is a warm, moist, dark environment. And as we know, KZN is quite humid, and it's nice and hot. So it's a very conducive environment, but even more so when you're wearing closed shoes. When you wear closed shoes, you're creating a perfect environment for that to breed. So the idea is to destroy the environment with, or minimize conditions. Say, for example, in closed shoes, if you have to wear a closed shoe, try and make sure that it's breathable material. If it has to be hard material, like you find a lot of workers tend to wear steel cap boots, that's hard material. You can't do so much about that, but make sure that the shoe fits well, that there's enough room in the shoe for a little bit of air circulation. Wear cotton rich socks. Cotton rich socks, because cotton is a natural fiber. So with natural fibers, they tend to have antimicrobial properties. So one, it will fight the fungus in that, it will prevent fungus multiplication in that respect. But also if you sweat, it absorbs moisture. Whereas a man-made fiber like polyester will encourage heat, encourage moisture, and because it doesn't have those natural antimicrobial properties, it will encourage the growth of the fungal spores and bacteria as well.
So, obviously, we're on our feet daily. Are there daily tips on how we can take care of our feet? Probably, for us that are working and, we got to wear closed shoes. Some healthcare professionals have to wear closed shoes. We go home. Is there aftercare tips that you might have?
Continuing from where I was, you also have to bear in mind that obviously washing your feet every day is important. Washing your socks every day is important. Now, when you wash your socks, you're washing away the fungus. You're not killing the fungus. So it's important that, particularly if you're prone to athlete's foot, if you're prone to fungal nail infections, that you use a fungicide in addition to that. So yes, basically washing your feet every day. Make sure you wash in between your toes with something rough, like a face cloth or something rough to get rid of dead skin, because that's what a lot of people tend to forget to do. Dry thoroughly. If you encourage moisture, that encourages fungal growth. So that's what you're looking at. But once you have the fungus, treatment is important because it doesn't go away unless you treat it. Um, Treatment is quite complicated, particularly with fungal nails. Fungal nails, you must bear in mind that it takes a long time to treat it. People can't go on treatment for about 2-3 weeks and expect it to go. It's several months to get rid of fungal nail infections, and then about a month to 3 months to get rid of athlete's foot, which is the skin infection.
And how can our listeners eliminate foot odors?
Foot odor is usually created by bacterial infection. You do get odor from fungal infection, but more so the bacterial side. So if you have sweaty feet, with sweaty feet, again, wash your feet regularly. Make sure you dry them. Wear cotton socks. Make sure your shoes have enough room in them. And there are also over-the-counter products that you can get. There is actually an antiperspirant for your feet that you can get. Antiperspirant for your feet. You can use a powder. Now, research has it that in KZN, some antifungal powders do not work because of the strain of the fungal infection, of the fungus in KZN. So when you use powder, the powder is about absorbing moisture. It's not necessarily to fight, to kill the fungal spores. So you can use powder, and bacteria's an antifungal spray would be ideal to get rid of the fungus. But it's like, for example, when you sweat on your underarms, that creates an odor. So using an antiperspirant helps to prevent that odor. Same thing with your feet. There are also other products out there like charcoal insoles, which absorbs moisture as well as absorbs odor.
Are there any home remedies? I know people speak about soaking your feet in salt or bicarb. Is there any recommendations?
When you soak your feet in salt water, I normally recommend that if you have if you have an open wound, if you have a bacterial infection, because salt water is good for getting rid of bacterial infections. Then if you soak your feet in Epsom salts, which some people do, that is to relax your muscles. It's not necessarily to fight any infection, it's to relax your muscles. If you soak your feet in vinegar, vinegar has antifungal properties, so you would use it if you have bad fungal infection in your skin. So different things for different reasons. Just be aware of that and know which one to use for it. When you're diabetic, it's advisable to avoid soaking your feet too often because of risk of making your skin too soft, and then it breaks and then leads to other complications.
And Vuyelwa, in your experience talking about shoes, can you give our listeners some advice on everyday wear in terms of activities?
Wear shoes fit for the purpose. You find that a lot of people come with corns and calluses. When you get corns and calluses between your toes and on top of your toes, that's purely as a result of footwear. In the odd cases, you might have deformed type of toes where they can't avoid putting pressure on those areas, and therefore they develop corns and calluses. But in most cases, it is purely as a result of footwear. So if you wear the right size fitting footwear, you prevent those problems. Yeah. Sorry. What was the rest of the question?
In terms of activities, well, it makes sense
Yes.
that, they have to wear the shoe that's comfortable enough. I mean, I've got a bit of an issue with my personal shoes
Mhm.
that I love heels. I love my stilettos. I think I wear shoes to make a fashion statement. And I think long term, I'm actually damaging my
Damaging
spine.
your
That's what
feet.
I've been told.
Yeah.
Yeah, and damaging my
So it
feet.
depends on what you do. You can wear your high heel shoe if you're wearing it for a short period of time. You're looking for about an hour, a couple of hours. If you're working in the type of job where you have to wear something and look pretty, just make sure that you're off your feet, not on your feet. If you're on your feet, unfortunately, you are damaging your feet, but that's why the podiatrist is here. So you can come to the podiatrist. But then in most cases, if you're doing a lot of walking, a lot of standing on your feet, it's advisable to wear something like tackies, trainers, something that's soft, something that's got enough room, something that is supportive. You'll find, as we come later on to the question, that with tackies, you've got tackies for different occasions as well. You've got your dressed fashionable tackies. You've got your tackies for a bit of walking around. You've got your tackies for the older generation, which one of my colleagues actually was highly involved in creating that tacky. So at least it's got podiatry knowledge behind it. You've got tackies for running and different distances in running. So there's, a shoe for every occasion. Just make sure you're wearing the shoe for the occasion. You've got workers who work in, heavy plant industries who need steel cap boots and wear the shoes for those occasions. Sometimes I get patients come in and say, these shoes are painful. Could you ask that I wear a tacky? In most cases, it's no. You're in an environment where if something drops on your foot, it's either lose your foot or wear the right type of shoe. You can wear steel cap boots that are comfortable. So it's about looking for the right type of shoe for your foot.
Vuyelwa, you made such a good point that corporate businesses focus on elements of medical, clinical exams and glucose monitoring and other aspects, but focusing on your staff members' feet, if they're working on their feet as an 8 hour or longer, it's important to obviously look at that wellness and make some recommendations.
Definitely. I find that particularly with nurses. Nurses have got the worst shoes out there, and I keep wondering why you're not complaining about that. Because you find a lot of nurses are on their feet all day. They wear court shoes which squash their feet, and they come to me with a lot of problems. If you look at certain health professionals, like say physios, you find that most physios walk around in tackies. They know the importance of wearing and their profession allows them to. So the nursing industry needs to look at that and look at making sure that nurses are wearing the right shoes fit for their purpose, because they're on their feet a lot.
If we have medical professionals listening and you're in the nursing career, please take note. Your feet is important to us. So Vuyelwa, tell us, what are some common foot disorders you see at your practice?
As mentioned, Cohen's calluses is the main thing. You get a lot of people with bunions. Bunions is a deformity of the big toe joint where the big toe goes in, deviates laterally, and as a result it affects the mechanics of the foot, and then as a result of that, you get pressure in undue areas. You get a lot of diabetics. A big part of podiatry is working with diabetics, because diabetics are prone to complications that can result in worst case scenario, amputation in their feet. So it has been researched that the podiatrist's involvement in a diabetic's life reduces amputation by about 80%. So that's a big part of our work that we do. We also deal with a lot of heel pain. We design orthotics because the podiatrist spends about 3 to 4 years studying the foot. We know the mechanics of a foot, so we are very specific, accurate in designing orthotics to put into the feet to realign the foot and make it function maximally.
Listeners, please don't neglect your feet. heartbeat. The reason that I have our guests here today is I'm in a rehabilitation center. I see those amputations come through. It's real. It leads to gangrene, and it starts off as simple things of not taking care of small wounds in your feet, not seeing a podiatrist or a wound care timeously, and it actually lends itself to other serious ailments, which is unfair because our feet should be prioritized. We're on a roll,
That's very true.
listeners.
That's very
And
true.
hold on to your seats, or should I say shoes. We're going to take a quick advert break. And when we return, we'll be getting back to the good stuff with Ms. Vuyelwa Mpala, our fabulous foot expert. And we'll be diving into the nitty gritty of foot care.
365. Get ready. Baldwin Spanishes is bringing you unbeatable deals you don't want to miss. Stay cool this summer with the TCL 12,000 BTU split unit aircon. Now only 5,499, and it comes with a massive 5-year warranty for total peace of mind. And for the perfect night's sleep, grab the Signorini Hamilton Queen Bed, a luxurious pocket spring, pocket coil mattress going for only 5,499. These deals are only at Baldwin Spanishes superstores, Pietermaritzburg. Don't wait, shop today.
ادعو إلى سبيل ربك بالحكمة والموعظة الحسنة وجادلهم بالتي هي أحسن. Invite all to the way of your Lord with wisdom and beautiful preaching, and reason with them in a way that is best and most gracious. Join Shabir Pasha every Saturday at 7 p.m. on the show Dawa Dynamics, and every Sunday on the Dawa Chronicles at 9 p.m. Remembering the companions of Prophet Muhammad, peace be upon him. Join the discussion, analyze the lives, sacrifices, and contributions of the Prophet's companions, and learn from their experience.
Every day, thousands go to bed hungry, but you can change that. With just 10 Rand, you can provide a loaf of bread. This bread is more than just a donation, it is a lifeline for so many families in need. Be part of the Al Ansar Outreach Slice of Life drive today. Call Outreach on 031 208 1601 and make a difference one loaf at a time.
Doctors and guests on a medical files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Ansar will be held responsible for any ill health caused by the advice given on Radio Ansar.
To a live broadcast from Radio Al Ansar, Pietermaritzburg, 105.6 FM.
There's a path for you if you want it. The street is surrounded by thorns. Oh, you'll see and smell roses you think you like. They're only there so you strike from the course. Chance that I get when it's feeling so hard. Praying for guidance and hoping your heart's my heart. Love and faith filling up, but I know it'll fall. Waiting for long. God, can't stop. Won't slow up. Keep walking. We fall down. It's all good. Keep holding. Keep falling down. I'm on my knees for you. I will be to my knees. I'm on my knees for you. Anything for you. I will
Assalamu alaikum wa rahmatullahi wa barakatuh, listeners, on this beautiful Mubarak Saturday. You are connected on the Peter Marisburg Pulse on Radio Al Ansar 90.4 and 105.6 FM. We're glad to be back and we're diving straight back into the good stuff. We are talking foot care. And we got the perfect expert to guide us, the fabulous Miss Mpala, who's a podiatrist extraordinaire. With over 20 years' experience, Vuyelwa is sharing her expertise with us from diabetic foot care to sports injuries and everything in between. She's here to get your feet up and get back into conversation. So, Vuyelwa, it's great to have you on the show. Can you tell our listeners what's the best treatment for heel pain?
Okay. Heel pain, a lot of people come in and call it plantar fasciitis. So plantar fasciitis is inflammation of the plantar fascia. It's a skin that covers the bone on the inside of the foot. And it's not always the same cause that results in heel pain. There are different rates. So it needs to be assessed, and to your heel, you have different sections of your heel. Some people get it right in the middle of their heel, on the sole, plantar aspect. Some people get it behind their heel. So you've got different tendons and ligaments that attach to your heel. So it needs to be assessed to find out which one exactly is causing the pain. And sometimes you also get bone problems. Sometimes you get tumors. It is quite rare to get tumors, but it's just to explain that there are different reasons why you get heel pain. So not one treatment. It's not one treatment for basic heel pain. There are different treatment measures to it, and so when you see a podiatrist with heel pain, I have to go through the whole assessment, assessing the way you walk, assessing why you're getting the pain, where you're getting the pain, what triggers off the pain, what relieves the pain. All these things need to be assessed to figure out what exactly is causing it. And then once we've figured out what's causing it, then we address it from that angle. In most cases, I tell a lot of my patients that when you're treating heel pain as well, you treat the pain. There's treatment of the pain. There's treatment of the cause of the pain. There's treatment. There's your daily management of the pain. All the things need to be addressed when you're treating heel pain, or you don't get rid of the heel pain. You can treat one aspect, but because the cause is still there, you might get rid of the pain for a few months and then it comes back. And then the degree of the pain also determines the course of treatment.
Yes.
A lot of cases, orthotics are required. Orthotics to realign the foot so that you're not putting undue stress on certain tendons and ligaments and muscles.
We have a question from one of our listeners, is how can I manage an ingrown toenail and how do I clip hard nails?
Okay. With hard nails, you get hard thickening nails. In some cases, again, the degree is to be assessed. In some cases, it's normal. Some people come in with what they consider hard nails, but your nails need to be hard to a certain degree. As you get older, they do get harder. Now, trauma to the nail results in thickening to the nail. Trauma comes from banging your toe against the bed. It comes from dropping things on your toes. It comes from rubbing on your shoes over the years, which results in hard or thickened nails. When you traumatize the nail, unfortunately, it makes it weaker and more susceptible to fungal nail infection. So if you have a traumatized nail and you create the right environment for fungus to grow, you will get a fungal infection in the nail. When you get a fungal infection in the nail, and some fungal infections cause thickening, so your nail thickens even more. When you find it difficult to clip such toenails, see your podiatrist, because the podiatrist has the right tools to manage this. And also the podiatrist can give you tips on ways to cut it. It depends on the degree on the nail and the degree of thickening.
And I'm sure that the diabetics need to watch out for the way they cut, not too deep. And
Yes, the general advice for cutting toenails is make sure you cut them straight across, not down the sides. When you cut down the sides from your position, you might leave, depending on the shape of your nail, you might leave a sharp edge down the sides, which you can't see. And if you can't see it, those sharp edges, as they grow, they dig in and pierce the skin and cause ingrown toenails. So the podiatrist also does ingrown toenail surgery, which is to cut out the sides of the nail and stop those sides from growing back so that it doesn't cause a problem again. So you find if you have such a situation where your nail is digging into the sides, causing pain, you have the option to have it cut back by a podiatrist to alleviate the sharp edge, or to have nail surgery, which is a more permanent solution. Again, depending on your health state, sometimes that is an option, sometimes it's not an option. Okay, usually if you're a badly controlled diabetic, it's not an option, but in most cases it is. When you have ingrown toenails, it's important as well that you wear the right fitting shoes, because ill-fitting shoes can aggravate the problem.
And how would our listeners know if they have an infection, and when should they seek help?
Signs and symptoms of an infection are pain, swelling, redness, heat. You find that in some skin colors, basically the lighter skin colors, it will be a redness. In people of color, the skin tends to go darker, as opposed to, you can't really see redness, so you see a darker skin. Those are all signs and symptoms of infection. Particularly if you have 2 or 3 more of those signs and symptoms, then it's definite infection. You want to have something done about it.
And what is hematose, and how can it be treated?
Hematose are when your toes are clawed toes, basically. In medical terms, it's when you've got bending of your distal interphalangeal joints. This is usually caused by wrong fitting shoes. So it's really important to wear the right type of shoes. But yes, it's when your toes are clawed. And also you tend to get clawed toes more with people with long toes. When you have long toes, people tend to claw their toes to keep their shoes on, or if they're wearing bad fitting shoes, it's easier to claw your toes. Over time, this becomes more or less set, and then depending on whether you have arthritis later on in life, it can become a fixed condition.
We're going to take a small nasheed break, and when we connect, we're going to be back with Miss Mpala, our fabulous foot expert, who's going to actually give us the nitty-gritty about foot care.
جئت لنا خاتما للمرسلين بدر الدجى رحمة للعالمين أبا الزهراء كم أشتاق لنلتقيه وأرى عينيك في الجنة تحت النخيل فيك الجمال والأمانة والوفاء عطر قد فاح نور عمر في الآفاق سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي والسماء والقلب بات يهتف لك بالصلاة أحسن الناس سيد ومصطفى خير الورى صلى عليك الرحمن فيك الجمال والأمانة والوفاء عطر قد فاح نور عمر في الآفاق اللهم صل وسلم وبارك على سيدنا محمد سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله سلام عليك يا حبيبي يا نبي الله سلام عليك يا حبيبي يا رسول الله
medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al-Ansar may help health caused by the advice given on Radio Al-Ansar.
You are listening to a live broadcast from Radio Al-Ansar, Pietermaritzburg, 105.6 FM.
Listeners, on this fine Saturday in Pietermaritzburg, on the Pietermaritzburg Pulse Show, with myself, Shubnum Ismail. Get ready to put your feet forward. We're talking feet, folks, and we've got the perfect expert to guide us through the world of foot health, the lovely Miss Vuyelwa Mpala. How are you this Saturday morning? And it's great to have you on the show.
Thank you. I'm doing very well, thanks.
We've covered quite a bit regarding fungal feet and a little bit about hygiene and foot care. We're going to actually dive straight in, and we'd like to enlighten our listeners on what type of shoes are best for running or hiking.
Okay. It's you need to go to a sports shop and find out what they have. If you tend to find that if you buy good branded tacky sports shoes, you will have a basic good tacky, good running shoe, good. There's also hiking shoes. Hiking shoes are designed so that they grip the ground better. Running shoes tend not to. So running shoes, go to a running shop for them. There is so much variety. I recently attended a conference where they expounded on all the different running shoes that are there, and there is so many. You really do need an expert, and tacky shops have those experts. So I would say rely on their advice when you go and buy a running shoe. It's when you have a problem. Say when you're running and you get pain in certain areas of your foot. Remember, people's feet are designed differently. The alignment can be slightly off by about 1 degree, and that causes a problem. So it's when you have a problem that the podiatrist now comes in, assesses the running shoe, and devises something that they can put in the running shoe to help alleviate the problem. Hiking, it's again, the shoe is, go to a good hiking shop and you get a good hiking shoe, but it's if you get problems when you are hiking, and the podiatrist will assess the problem and figure out what's causing the problem. As long as you buy a shoe fit for purpose and the right size. So now coming to fitting for shoes. When you're fitting for shoes, I generally advise make sure that your shoes are wide enough for your toes, um, wide enough, deep enough for your toes. You should be able to move your toes up and down in the shoe. Make sure it's long enough. Between your longest toe, which is either the big toe or the second toe, there needs to be a thumb's width space between the toe and the end of the shoe. If you don't leave any room, when you're walking, your foot slides and jams against the front of the shoe, which causes certain problems, be it problems with your nails or corns and calluses from clawed toes, different reasons. With it having enough space in the front, make sure that there's something, and make sure the laces, Velcro strap or buckle that fastens across the top of the shoe. Okay, that's with a closed shoe. And that when you go to a sports shop and you buy a running shoe or a hiking shoe, the customer services lady would normally advise you and tell you that you need to make sure that there's enough room in the shoe. If it's a sandal, same principle, just try and make sure that it fastens around the ankle and the straps are not too tight. But yeah, when you're buying a shoe, please try and make sure that there's enough space. If there's not enough space, you give yourself problems.
And for our listeners that's diabetic, how often they need to have their feet checked, and how can they prevent diabetic ulcers?
Okay, with diabetics, a diabetic only becomes a problem when they don't have good circulation to their feet and nerve damage in their feet, which is caused by high sugar levels. So high sugar levels destroys different tissues in your body. In your feet, it's the main circulation to your feet that's affected, and it's the nerves in your feet. So if you don't feel too well, you're not going to respond to injury stimuli. If your foot gets knocked, if it gets cut, you're not going to feel that, and then you're not going to react. And as a result, you're more likely to get problems. So that's how ulcers come into being. If you're putting pressure on an area that's, say, been cut, or if you get corns, calluses, and you put a lot of pressure on that, the skin starts to break down. You get an infection in the cut or the wound, and then it spirals. It gets worse and worse. That's where diabetics have a problem. So a lot of factors need to be managed when it comes to diabetic wound healing. You need to manage, make sure that they've got good circulation to their feet, make sure that you can't reverse nerve damage if they lose protective sensation. So you need to devise methods to take pressure away from where they're getting where they're getting high pressure points, where they get wounds or ulcers. If they do have those wounds, ulcers, we need to make sure that they don't get infected. The patient understands what to look out for if it does get infected, how to act once it gets infected, and what best dressing regime to manage. We tend, here in Maritzburg, South Africa, we tend to work a lot with wound care nurses as well in managing wounds, because they have a lot more they have access to a lot more, but we need to work together to manage those wounds and diabetic ulcers.
I have a question from one of our listeners. What are some tips for me to manage my foot pain that I have, considering I have diabetes?
Oh yes, another thing that diabetics do get is what we call diabetic neuropathic pain, which means that your nerves have been damaged and therefore your nerves are firing in the wrong way, giving you different sort of pains. You can get burning, you can get pins and needles, you can get stabbing pains in your feet. Those are just some of the symptoms. Sometimes if you don't have good circulation, you get a constant just pain, like a sore pain in your feet. In those cases, first thing for all diabetics, work hard to manage your sugar levels, because that's what damages things in the first place. So work with your GP. There are diabetic specialist nurses who help you to control sugar levels. Work hard to control that. Exercise is important, so that we encourage that as well, and eating the right food. So make sure you've spoken to a dietitian to make sure that you're on the right track and eating the right foods. these are all the healthcare professionals, especially if you're on medical aid, is part of what they will pay for under your prescribed medical benefits. So see them, make good use of seeing all the healthcare professionals, and you prevent problems. But once you get those pains in your feet, there are things that you can take to get rid of the pain medication. In most cases, the first line of treatment is vitamin B co, because that helps with repairing nerves. But to make sure you're eating a well balanced diet, that helps. Then there is, usually it's a last stage that I advise patients, if you can avoid getting to that stage, avoid it. But there's neuropathic pain medication that the doctor can prescribe. You start off taking that medication, it has its effects, but then after some time, you might have to titrate, increase the dosage of the medication, which you don't want to get into that position. So control sugar levels first and foremost.
Do you see a lot of pregnant mummies coming to see you?
I have some. Usually they come after. With some women, the shape of their feet changes as a result, and therefore it depends on what they're wearing. That affects their feet. Some of them get tendon and ligament problem and therefore pain as a result of that, and it can linger to after birth. So yes, in some cases I do, but sometimes pregnant mummies are more concerned about the baby than themselves. So you find that they focus more on their growing baby than they do their own health. So some of them at the point when they're getting their problems during pregnancy, they don't focus on themselves. But yes, you can get problems when you're pregnant.
We are in the holiday season and our kids are playing around. Is there any tips on sport injuries and prevention with feet during the season?
The main thing, as I have been saying, is make sure you're wearing the right shoes for the occasion. A lot of people say that walking barefoot is best. That's, I feel, a myth that needs to be debunked, because not necessarily. It depends on your feet. Okay, if you have certain foot conditions, sometimes you don't want to be barefoot. If your feet are okay, it's okay to be barefoot, but at the same time, be careful of where you are. If you're walking along the beach, there are a lot of sea urchins that leave spikes in your skin, and that can be very painful and and difficult to dig out, to get out, painful to walk on, and then dig out. So be careful about things. If you can wear flip-flops along the beach, do so. Yeah.
And can orthotics or insoles help with foot pain?
Yeah, definitely. They do help a great deal, especially when you get heel pain. A lot of people also tend to get pain along their arch. Orthotics help to support that. So there's a difference between an arch support and an orthotic. An orthotic is more functional, meaning it realigns the foot more. An arch support will just support your feet. So it depends on your feet, what problem you're having, that you see someone.
In terms of our listeners that have children, how much of issues you do experience at your practice in terms of kids coming in, and what are some of the common issues you see?
Okay, the most common issue with kids is flat feet. Okay, so a child, as they're growing, they're developing, their foot position when they're babies, toddlers, is not the same as when a little bit later on, say for example 7. We tend to, if you've got a foot problem as a child, we tend to only do something about it at about 7, after 7, when their foot has formed a little bit better and is not too much cartilage. What I find that I probably would advise a lot of parents is, if your children are flat feet and you particularly notice it after 7, see a podiatrist and have something done about it, because flat feet can worsen later on in life. It also depends on the person's activity, but it's best to see somebody and have something done about it at a young age, as opposed to waiting until they're much older to have something done, because by then it's a lot more work to get the condition resolved.
And Vuyelwa, how can our listeners get in touch with you, and any final words on the show today?
Okay, I am based in Pietermaritzburg. My main base is at Duzimed. I do go to Midlands Hospital and Hilton, a practice in Hilton, Medcare, on a Friday afternoon. So that's where to get in touch with me. Basic advice is look after your feet. Pain is an indicator that something is not quite right. So if you have pain in your feet, get that checked. Adhere to basic foot hygiene. Your feet want to be kept clean like the rest of your body. So don't forget that they, are attached to the body.
I'm definitely going to actually head off after the show and get myself some comfortable sneakers for this holiday season, since I'm going to be running around and definitely doing some hiking, as we discussed earlier.
Awesome.
So thank you so much. And as we wrap up today's episode of the Pulse Show, I want to thank you for being part of the show and sharing such expertise regarding our foot and foot care and health and hygiene. And to our listeners, thank you so much for keeping in touch and connecting with us, and keep joining us on this journey of discovery and growth on the Medical Pulse Show. Your participation and engagement means the world to us. Until next time, stay blessed, stay informed, and remember, Al Ansar is here to illuminate your path. Jazakallah to our technical team. Inshallah, we will connect with you next Saturday again. From myself, Shubnum Ismail, Assalamu alaikum wa rahmatullahi wa barakatuhu.
Guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Radio Al Ansar, 24/7, 365.
An informative Islamic global perspective. This is Al Ansar News.
Making news at 10, ANC insiders have revealed that are gossiping about each other at the Luthuli House and prioritizing to be elected as leaders over rebuilding provincial structures is what led to the KwaZulu-Natal ANC provincial task team being shown at the door.